Hey students, welcome to sqadia.com. Let's talk about pathology of myocardial infarction. Within 0 to 12 hours, there is no visible macroscopic change. Infarcted muscles appear uncolored on staining due to loss of oxidative enzymes. Non-infarcted muscles stains blue. After 12 to 24 hours, infarcted muscles appear pale with blotchy discoloration, highly eosinophilic with intercellular edema. After 24 to 72 hours, dead area appears. Infarcted area excites an acute inflammatory response. Neutrophils infiltrate between dead cardiac muscle fibers. After 3 to 10 days, a hyperaemic border develops around the yellow dead muscle, organization of infarcted area replacement with vascular granulation tissue. Weeks to months late, white scar is formed. Due to progressive collagen deposition, infarct is replaced by a collagenous scar. If your books are giving you hard times, join us on sqadia.com.